right, welcome back to all the lovely people who stay tuned. And in this segment, we are going to be discussing some integral issues that are affecting millions of people across the globe. That includes kidney stones issues, issues regarding bladder, urinary diseases, and much more, right? So why are these symptoms being ignored? How can we mitigate these issues? And how can we move on to better and healthier lives? To speak more about this, we actually have a guest in our studios today. Why don't you introduce him, Muzammil?
We have consultant urologist Dr. Fartash Sarwar Saab, our esteemed guest here in the studios. And this is a serious topic because it impacts millions and millions of Pakistanis. We are surviving on water that is not up to the mark when we talk about the majority of Pakistanis and the majority of Indians and Afghans and people of the South Asian region. We have seen problems like kidney stones all the way up to several types of cancers, and all of this would be brought under the light. Now, sir, thank you for taking your time out and joining us here at Pakistan TV.
Thank you for having me.
My first question is, we are suffering from a pandemic that is not being talked about, and that is diabetes. And diabetes for Pakistan, we had another esteemed guest here at our studios. He said 1 in every 3 people is either pre or diabetic. So with those numbers, how can we take good care of our kidneys and overall health when we talk about the renal aspect of our bodies?
Well, I think you've raised a very pertinent question. Diabetes probably has the largest prevalence in Pakistan, and it's almost about over 30% in Pakistan, which is the highest in the world. So considering that fact, there are few things that we need to consider when we are considering the health of the kidneys. Now, I must mention here that in a diabetic person, we need to monitor 3 things on a regular basis, and one is his blood pressure, his or her blood pressure. The second is the health of the kidneys, and the third is your eyesight, because these are the 3 things that are constantly being affected by diabetes. And if you combine diabetes with hypertension, which also has a very high incidence in Pakistan, that makes a lethal combination for the kidneys. Okay. So we need to monitor the creatinine level. That means how well the kidneys are clearing all the junk in your body. So considering what we need to do to prevent any damage is, number one, that we need to keep our sugar at a low level. That means having diabetes or being affected by diabetes. I mean, one example in front of you is Asim Akram. He's had diabetes for ages now, but he's one of the healthiest people that is in Pakistan. So if you control your diabetes, your HbA1c, the parameter that tells you what your sugar has been for the last 3 months, is under control, and your blood pressure is under control. So if you keep those parameters in control, there are very less likely chances that you're going to be affected by any kidney disorder. And for that, you need a healthy lifestyle to control your diabetes and your blood pressure.
Oh my God, you've definitely hit the nail on the head. You've explained that very accurately and given us a sigh of relief regarding our health, right? So you are exactly a urologist. What exactly is a urologist, and when is it important to visit one?
Well, a urologist basically is a surgeon. And he deals with all the issues regarding the kidneys, the bladder, male infertility, and all those other issues. So basically, if I were to put it, a urologist would be a male gynecologist, a mirror image of what a gynecologist does for a woman. That is what a urologist does for a male.
Now, when we talk about today's day and age and the amount of processed food that is in our diets, there is a problem that is not being talked about all that much, and that is the rise in male infertility. So what is the dietary change that Pakistan needs to make to support better health?
Well, the fertility rate in Pakistan is already one of the good fertility rates that currently exists in the world. But having said that, it has declined over the past many years. And to keep a healthy fertility rate, I think coming to the processed food, there's not actually, this has not been linked directly to male infertility, and there are many taboos and there are many misconceptions about male infertility. But when a patient of male infertility comes to me, we need to first of all evaluate what is causing his infertility, and that encompasses a lot of things. So if I were to, specifically look for one or two things, then that would be what his sperm count is, and a semen analysis, and an ultrasound or two. But history is also very important. Has he had any surgical procedures before? Has he been, has he had mumps before? Has he been, has he taken any medications of that sort? Has he been working in any place where, there are a lot of radiations? For example, an X-ray technician is more prone to have. In addition to that, those people who stay near the fire,
right,
and who cook, who love to cook, there is an incidence of their sperm count being low. In addition to that, you need to also take into consideration if he's had any infections in the past. So we have to consider multifactorial things before we come. If obesity in itself is not something which
I apologize for cutting you off over here. Since you're talking about all of these conditions that can affect male health, and urologist being the male gynecologist, that's a creative way to put it. We have a lot of products, beauty products, say for hair loss, DHT blockers, and a lot of other products that are being used in the industry right now. How much of a problem are they for the health?
Well, that's a good question, because one of the products that you get is finasteride, and that basically blocks your testosterone, and that decreases your libido, or to say, and it can cause male problems as well. And it can also, bring down your sperm count on a long basis if you take that too. So that is also something that we need to consider. And I have had multiple patients coming to me, and they say that we've been taking, medications in addition to when we had a hair transplant. So we need to take that into consideration once they come, because we, as I said, evaluating a patient includes his history and his physical exam. So we have to take I have to take a detailed history, and I have to probably run some tests as well, and then we can correlate them together.
Right, so it's an issue that has multiple layers that needs to be tackled. You give such a brilliant explanation, so thank you so much for that. And one thing that is a pressing issue right now in Pakistan, that is kidney stone development, right? And I can see that for sure, because even I suffered from kidney stones, and I know around 5 to 6 people within my circle who have suffered from kidney stones as well, young people, old people, everyone. So why is it increasing at such a rapid pace in Pakistan, and what factors are causing it?
Well, then again, I must say we're not very lucky in that, because Pakistan lies in the red belt, and the red belt means that we have the highest incidence of kidney stone formation in the world.
Oh my God.
One of the highest incidence of kidney stone formation.
So
in the
one
world.
of the most fertile population with one of the highest incidence of kidney stones.
And mixed with diabetes and heart disease. I mean, we are number one in something.
Gifted people. What can I say? We are gifted people. But having said that, I think, if I were to make a gist of all of it, what we need to do is we actually need to work on a healthy lifestyle. That's very important, and we consider a healthy lifestyle of eating oily foods, and we love junk food. So we need to take all that in consideration. We actually like to consume a lot of salt.
Right.
And we don't want to drink a lot of water, but then again, what quality of water, as you pointed out, what are we actually drinking? So if you take a lot of salt, and if you're drinking less water, because our temperatures go sky high in summer, plus if you love meat, and there are certain foods which have high oxalate levels, for example, beetroot, for example, even coffee, for example, broccoli, I'm sorry, not broccoli, nuts that you eat in winter. So all these foods, they can actually increase your...
so you need to drink a certain amount of water to mitigate this issue.
Actually, what I'm trying to say is that you need to have a balanced diet.
Right.
Now, meat is important. It forms hemoglobin, and vegetables are important. They give you, a certain amount of vitamins.
Right.
What I'm saying is that you need to keep it balanced.
All right. And what about some vitamins that we take? Does that impact kidneys as well?
Well, I think green leafy vegetables, as a rule, are good, but then again, if you are a constant stone former, there's one very important thing, and that is which we call supersaturation. You know, if you have good calcium in your body, you're not going to have stones. If you have high calcium, you're going to have stones. If you have low calcium, you're going to have stones.
Oh my God, brilliant explained.
Yes, so you need to have a balanced diet with
Now,
calcium.
for our viewers, we're short on time, and every time we have such guests over, I request our management to extend the time of the show because there's so much to discuss and learn. Unfortunately, we are short on time, so thank you for taking your time out and joining us here. This was Dr. Fartash, and we will be seeing you next week, same time. Probably Shahzad Khan's going to be back, so you wouldn't have to bardasht me over here. Oh, I'm being told that he's not here for a month, so I mean, I'll be here. Now, PakistanTV.com is our website. Be sure to check that out and also leave a comment on the YouTube channel. Let us know what you want to see in here on Pakistan TV's your favorite show, World This Morning. More information coming your way. Stay tuned and bye-bye.